So we are a Group C, or the Health and Public Safety bills.
Mhm.
So the first bill for me was Senate Bill 96, or Chapter 336. So this bill was kind of special because usually most bills go through the Senate and the House chambers, but this bill went straight from the Senate to the House and was passed straight directly through that. So it only has a Senate bill. And this Senate bill allows all service members and their families to benefit from the Sheila Hickson grant, which is a grant for active service duty members. And what happens is there's a foundation that supplies nonprofit organizations with money, and the nonprofit organizations will help military members and also veterans to be able to get health care. Specifically mental health care. So this bill expands these nonprofit organizations' reach to not just active duty members and veterans, but also those in the reserve forces, such as the National Guard. And it impacts roughly the 60,000 members of the armed forces and then the hundreds of thousands of veterans in the state of Maryland. And it was signed on April 28th in 2026. So why I chose the bill was a single wording change impacts thousands of lives. So like on the outside, the bill looks really simple because it's just removing two words from each line of a piece of legislation. But in reality, those two lines were essentially blocking those who were still serving the country through the military in the form of the National Guard from being able to get benefits from these nonprofits to get health care that they needed. And that's incredibly important given the amount of mental health disorders and health issues that both veterans and all members of active duty face. So by being able to expand healthcare, it allows them to be able to get what they need. So mainly is stressing the importance of that any politician's words, even just two words that they may put down on a bill, has the implications of impacting thousands of lives.
Um, I did my research on Senate Bill 276, and it was also cross-filed with House Bill 445. And this bill was an expansion of the So Everybody Can Move Act from the 2024 general session. And it was a bill providing insurance coverage to only prostheses. And prostheses are artificial devices that replace like missing or like broken parts of the body, so like artificial limbs. And through the passage of Senate Bill 276, the 2024 bill was expanded because the insurance coverage was extended for orthoses. And orthoses are external support devices like braces or splints. And the other major part of this bill was that insurance companies were prohibited from placing their own guidelines, deeming these assistive devices like orthoses and prostheses to be medically necessary. And this was really important because if people wanted to gain coverage for a device, their device would have to be considered medically necessary and confirmed by a medical professional according to these standards. And in summary, the passage with this bill really important because it was holding insurers accountable and was the first to mandate coverage for orthosis. And it was signed in on May 26, 2026, and will take effect on January 1st, 2027. The reason why I chose this bill is because when my group had to choose a bill from the health bill section, I wasn't really interested in one specific topic, but the word orthosis from the bill summary really stood out to me because I didn't really have prior knowledge to what it was really about. And with more like reading of the bill summary, I was really interested about how legislature was holding up healthcare rights for Maryland orthotic and prosthetic users. And additionally, since I didn't have much like experience or knowledge with prosthetic and users, like orthotic users myself, I was actually curious to research more about their like challenges and like perspectives of healthcare like laws that these groups of people had.
I did my research on Maryland Senate Bill 159, which mainly focuses on improving emergency medical services throughout the state of Maryland. And this bill was originally intended to address a major issue in Maryland, particularly in Baltimore, where many EMS crews resorted to using medically equipped SUVs due to the outdated equipment on ambulances. And this bill requires the Maryland Institute for Emergency Medical Services Systems to coordinate the minimum amount of equipment and medication that are needed to be available on EMS vehicles and ambulances, and especially supplies for infants and children. Um, this bill also requires all counties in Maryland that operate EMS services to conduct quarterly reviews of ambulance performance to ensure proper compliance of Senate Bill 159. And each bill is also required to establish a formal complaint system for handling complaints about ambulance quality and compliance to the bill. This bill directly impacts EMTs, paramedics, and ambulance services staff because they now have a clear standard and additional requirements for reviewing their services. And ultimately, the goal was to make emergency medical care more consistent and reliable for all Maryland residents. Um, Um, and I decided to research Senate Bill 159 because emergency medical services are something that anyone could potentially need at any moment, and I think it's important to understand how Maryland is working to improve the quality of emergency care. And even though this bill may not affect people in their everyday lives, it could make a major difference during emergency situations.
I chose Senate Bill 891 slash House Bill 1118. The summary of the bill. The purpose of this bill is to improve maternal mental health care by expanding screenings and treatments, providing better education and support for new parents, and more. This bill is important because it aims to identify perinatal, which is the time around like birth, mental health conditions earlier and improve health outcomes for both parents and children. The key points and goals of this bill is that it requires mental health screenings during a child's first year of well-child visits for the mother, and it includes insurance coverage, and it would begin January 1st of 2027. It educates parents on perinatal mental health conditions and available resources. It improves training for mental health care workers and providers, and it promotes early intervention and treatment regarding mental health issues. And I chose this bill because it's related to psychology and women's health care. This bill emphasizes the importance of perinatal mental health care and addresses the need to provide proper resources and support for new parents. I was particularly interested in the way the bill targets early identification and intervention, so possible conditions like postpartum depression and anxiety can't get worse or develop during the postnatal time period. Overall, I was interested in this bill because it addressed an important health issue that can affect many families and demonstrates how legislation can help make mental health care more accessible and effective.